said I don't like long introductions. Some of the worst moments of my life have been introductions. I was recently introduced by the Chief Constable of Warwickshire to a police audience who said, and now we have, I'm delighted to say we've got Michael Bichard, who of course is well known to the police. And he was the last person in the room to realise what he'd said, but there we are. I'm going to come at this, as you'd expect, not as a health professional, but from a public service perspective. And Chris mentioned that I'd been leading recently the Total Place initiative, which some of you would know a little bit about. I'm not going to talk about that in great detail, but I'm going to try and pick up some of the lessons from Total Place. And I think actually the major lesson from Total Place is that we can't go on like this, as they say. That there are some very deep and serious flaws in our public service system in the UK, and those flaws lead to too often poor quality service to clients, patients, customers, whatever you want to call them, and too often cost us huge sums of money. So my argument is that this isn't a time for evolutionary change in the public sector, it is a time for transformation. And one of the problems with transformation, of course, is that people say we need it, but they don't define, actually in the way that you have this morning, what we mean by it and how we move from where we are to a different place. And so I just want to spend my time this morning talking about what I think are the major flaws that we need to address. And in a way, you can interpret that within your particular setting. I think the first won't be a surprise to you. Randy picked it up in his own experience, and that is that in the UK, we have become too centralised, too prescriptive, and we need to be prepared to devolve, to decentralise, to empower, whether that means clients, whether it means communities, or whether it means our staff. Do we actually provide enough space and incentives for local citizens, for groups, and for staff to use their initiative where using their initiative is justified? We know that devolution, any of us who've tried to devolve within our own teams or organisation, we know it's not easy. You need to be clear about the extent and the limitations. You need to be clear about what accountability mechanisms are going to be in place. It's not abdication of management, it's not anarchy for people, but it is a prerequisite, I think, for greater success in our public sector. I think the second flaw is that we have become, certainly here, we have become obsessed with managing for compliance and not managing for value. What do I mean by that? Because it's a bit jargonized. Well, we've become obsessed, haven't we, with targets, with indicators, with inspections, with assessments, with advice, and with guidance. And we've judged success and we've judged successful leaders on whether or not they've complied rather than whether they have added value as judged by clients and citizens and communities. And of course, we all know, because they're a convenient scapegoat, that government's been the main culprit. But actually, again, I think if you look at many of our local public service organisations, the way in which we organise ourselves, sometimes I think we've been equally culpable. We've managed our staff too prescriptively, we've set narrow targets, we've given too much procedural advice and instruction. And that has got to change, particularly if there's not a great deal of money around, which there is not and there won't be. Then every pound that you invest has got to be money spent for value and not for compliance. And I think we all need to ask ourselves, even in our own individual institutions or in our own teams, whether we need to cut back on some of the process, some of the prescription. The third thing, and I guess this was the main lesson of Total Place, although I think many of us probably knew it before, we've not been very good at collaborating. Our governance structure has become very complex, with countless organisations providing services and support to citizens and to communities. There's very little now in the UK that can be achieved by any organisation working in isolation, and resources, I'm convinced, can be used much more effectively if there's real collaboration. It seems just plain common sense, and yet we still find it so difficult to achieve. We still make policy in silos, we regulate, we inspect in silos, we often deliver in silos. And as a result, policy and delivery often fail to address the total problem. And as a result, I think we miss huge opportunities to save money. And we often confuse clients who sometimes, families, are receiving support from 6, 8, 10 different agencies in an uncoordinated way. They're confused, it wastes money, it delivers poor quality service. And often, let's be honest, our attempts at collaboration, at better collaboration, have been at a very high level. We're quite good at creating concordats between organizations. We're quite good at senior managers sitting in rooms and producing partnership agreements. Very rarely have they actually made a difference to clients, to patients, and to consumers on the ground, and that must be the way we judge them. And I think what Total Place was trying to do was to focus organizations, institutions on real problems and say, how are we going to deal with this better? How are we going to deliver better outcomes? We don't need more partnership agreements. We also, I think, have failed to work effectively together at a very basic level in sharing services, in purchasing goods and materials. We actually spend in this country £220 billion a year in the public sector on goods and materials, well over a half of that on common goods and materials, things like energy, even basic things like paper. But there's hardly any convincing public sector purchasing strategy. I think we could actually kind of change the energy sector in this country overnight if the public sector got its purchasing act together. And why haven't we been able to do this? Well, of course, everyone can think of a reason why you shouldn't join together to procure. The answer too often, I believe, has been territoriality and sovereignty. We have been more concerned about defending our institutional boundaries than we have about saving money. And again, at a time when there isn't any money, I think our citizens, our patients, will look very dimly at a public sector that's not prepared to work more effectively together. The fourth flaw is I think we are much better at delivering services than we are at commissioning outcomes. I mean, the history of the public sector in the UK actually is about delivery. It's about delivering support to people and to communities who need it, safe in the knowledge, so it goes, that the only people that we can rely upon to do that fairly work in the public sector. And as a result, I think we've developed armies of people to deliver. I used to run one. I used to run the benefits agency. And I think one of the problems is that our focus, therefore, has very often been about managing inputs rather than achieving desired outcomes. And I think that now needs to change. We do need to focus more on outcomes, as Randy was saying. We need to worry a bit less about who does the providing. We need to be better at commissioning outcomes and more willing to countenance others providing services for the public good. The very fact that we use terms like public sector and public services rather than services for the public good tells its own story. In all honesty, across the public sector, you will tell me it's not the case in health. Commissioning skills are in short supply. And I think we have limited the extent to which new potential providers are able to enter the market by excessive bureaucracy in the procurement process. And I've chaired one or two small companies who've tried to break into the government system through the tendering process. I can tell you it is incredibly expensive and almost impossible to achieve. And then actually, then we've determined exactly how services are going to be delivered by external suppliers, so that there's very little room for them to use their initiative. The fifth thing is that I think, I know this is going to resonate with you, we've become much better at redesigning structures than we have at redesigning services. If a huge increase in investment, which is what we've had actually generally in the public sector over 15 years, fails to deliver the expected results, most reasonable people would begin to reconsider their business model. The English public sector doesn't do that. We reorganise our structure. We must by now have exhausted every possible structure for health, education and local government. Even as I say it, I have to say, well, maybe not. And this obsession with structure, actually it's evident in every organization I've observed and worked in. And the fact is that it rarely delivers. It rarely delivers performance improvements, whatever Tony Blair still believes. So this, I don't think, is the time for restructuring as the primary response. I'm not saying sometimes you don't need to, as you've done, change the organization, but as the primary response, structure rarely delivers. Instead, we need to think about how our services are designed. I'm chairman of the Design Council, and I get opportunities to see a lot of great designers at first hand. We have some fantastic designers in the UK. What they do, if you think about it, is design products or services around clients and potential customers. They make sure they work, that they're functional. They make sure that they're accessible, that they're affordable, and okay, that they look good so that people want to buy them. That's what Jonathan and I did with the iPod, with the iPad, with the iPhone. It's why half this audience probably has got one of those in their pocket. They reflect the way you want to behave and the way you live. Contrast that to most of our public services, which are not built around clients and customers. Many of them are not accessible, some of them are not affordable, a number of them don't work very well. It's a real contrast, and that's why I say we need to move to design services, not structure. And when you design services, you go beyond the bureaucratic boxes. You look at a service as seen from the client's point of view. And we deliver services still too often in bureaucratic boxes. Total Place also told us that we need to invest even more in prevention. Again, I think the way in which we organise our governance structure makes this sometimes quite difficult in the UK, because the organisation that's investing or should be investing in prevention is not necessarily the organisation that's going to reap the financial benefits later. So why should we do it? And I think we need to find new ways of incentivising prevention and early intervention. Because if we don't do that, the problems that are coming down the track are going to make even the recent financial crisis that we've been facing look small beer. And particularly in your area, if we don't find ways better to prevent chronic health conditions, and we were talking over dinner last night about diabetes, the financial cost of that is huge. It is not yet a lesson, certainly outside of health, that has been fully learnt. I think we need to work much better with the civil society. The rhetoric has long been positive. We need to work with communities. We need to work with the voluntary and third sector. But I've often questioned how genuine that is or how effective it is in practice. And I've chaired a number of voluntary sector organisations. I used to chair the compact between the government and the sector. And when I visit central government departments, I'm often left with a feeling that this is their equivalent of corporate social responsibility. It's the sort of thing we need to do. It's a nice thing to have, but it's not going to change the world. Well, actually, I do believe that working with communities and with the civil society can release huge potential and huge resources. And we need to be better at it. Because at the present moment, we very rarely involve those groups, those organisations in designing policy. We see them as just a delivery arm. We expect them to deliver at rather less cost than we would ourselves. And then we impose on them so many different audit regimes that their overheads soar, and then we say, well, there you are, I told you they can't actually run a tight ship. This is not a basis of a true partnership. It's more like Stalin's partnership with the Russian people. And it needs to change, and if the big society is about changing that relationship, then I, for one, am prepared to suspend our usual cynicism. We're also, despite some fantastic examples in the British public sector, NHS Direct, I think, is one of them, Open University is another, we're still actually culturally quite risk-averse. And my worry at the moment is that faced with the kind of crisis we're facing, we will become even more risk-averse. Because when you haven't got much money, people defend the status quo. They defend the resource that they've got. We won't get through this crisis unless we find ways of enhancing innovation within organisations. And because I'm chair of the Design Council, people often ask me to talk about innovation. And there's a lot of waffle and rubbish talked about innovation. And what we all of us need to think about is what we do in our teams, in our organisations, to enhance innovation. Our personal behaviour, When someone brings us an idea and we say, well, we tried that in 1948 and it didn't work, what impact does that have on the organization? Eliminating some of these narrow process targets that take away the space for people to be creative, rewarding successful innovators, not something the civil service does terribly well. They regard them as a bit of a pain and are quite happy when they move on. Managing risk effectively, getting rid of needless paper and meetings, interfering unnecessarily, and involving the front line. I visit a lot of organizations, a lot of government organizations. They can always take me to a good example of involving the front line. I was interested to use Lean. I can talk to you about coaching. I can talk to you about Quest. There are all sorts of schemes. Hardly ever do I see an organization where involving the front line is the way we do things around here. And when at the Design Council we did some work for health recently on designing out bugs, first thing designers do is go and talk to patients, nurses and porters. And we were struck by the fact that very rarely had they been spoken to about how you could reduce C. difficile, and came up with some really important ideas. Two last things, because I know I'll get the dreaded yellow card otherwise. I think Total Play showed us that we need to be serious about facilitating, I don't know what term you want to use, self-help, co-production. We've actually made it very difficult for people who want to help themselves to do so in this country. We've done that because we've got these countless organizations, we've got increased specialization, we've got enthusiastic professionalization. And when I see friends of mine who have got kids with learning difficulties or very elderly parents spending huge amounts of their time trying to make sense of the public sector that we have created. I mean, these are people who actually are a resource. They want to help themselves, they want to help their dependents, but we've actually made it very, very difficult for them to do that. And we need to stop and think about why that's happened and what we can do about it, and we need public sector managers and leaders who embrace the idea of co-production and who realize the need to engage all the resources in a community for the benefit of all citizens, particularly at a moment like this. And it's quite interesting that all the talk at the moment about transparent data that the Coalition is producing, and I support that, is about how we can create this new breed of armchair auditors holding the public services to account. I'm excited about the data, the information, and the transparency because I think it enables people to take control of their own lives. But we don't really seem to have grasped the potential. And that is also, finally, about realizing the potential of IT. We've talked about it endlessly. I don't think we've yet realized that potential. There are some excellent initiatives, but somehow we still see IT driving the business often rather than the other way around. We still too often see IT used to improve processing rather than transform the way we go about our work. And we still too often see examples of failure to involve the front line in the design and development of IT, and therefore a strong capacity to reject IT initiatives, which frankly they don't see as helping them to deliver a better outcome. In your world, I couldn't agree more, telemedicine must be the future to improve care, to reduce bed occupancy, and to improve the usage of specialist consultants. It seems to me that's got to be the way forward for health. It's got to be the way forward for many other public services. In conclusion, the 20th century, the end of the 20th century, public sector language was about centralization, specialization, targets, prescription, delivery, compliance, welfare, and structure. And I think that's got to change. And the 21st century has got to be about value. It's got to be about genuine collaboration. It's got to be about designing services. It's got to be about innovation, about prevention, and about co-production. And if that is going to happen, it requires really effective, convincing leadership. And I look at a lot of leaders at the moment in the public sector, and I talk to a lot. Some of them, frankly, are in shock. Some of them don't believe it is going to be possible to get through the crises that we're currently facing. I think what we do need are people who are confident but not arrogant, people who do believe it's possible to get through it, because actually, if the leaders don't believe it, what chance is there that anyone else working in our public services is going to believe that there is a way through this? I think there's a way through it. We just need to be prepared to change. Thanks.